Have you ever stopped to think how one tiny anatomical detail, something seemingly insignificant, could completely shape an animal's health, its future, even its ability to reproduce? It's kind of startling. But for a mare, a subtle physical feature can literally be the difference between successfully carrying a foal or not. Today we're doing a deep dive into equine reproductive health. We're focusing specifically on something called vulvar conformation. We've looked through the sources you gave us to really get a handle on this often overlooked but really critical aspect of mare fertility. Our mission here is to unpack the connection between a mare's physical structure, her anatomy, and her ability to reproduce so you walk away really understanding what's going on. Okay, let's get into it. The surprising thing about vulvar conformation, or VC as it's sometimes called, isn't just what it is.
Which is basically the physical relationship, the alignment between the mare's anus, her vulva, and her pelvis, right?
Exactly. But it's how this seemingly small detail can have such a massive impact on her ability to conceive and carry a foal. I mean, problems here are a major, often silent reason for mares being subfertile or even infertile.
Absolutely. And what's quite striking is how clearly vets have defined the different grades of vulvar conformation and how directly these grades link to how well the mare is protected internally. So when we talk about good VC, what we mean is the top part of the vulva, the dorsal commissure, is right where it should be level with or even slightly below the floor of the pubic bone. This creates a really effective side-to-side seal. There's no forward tilt, no cranial slant. It effectively shields the reproductive tract from manure getting in or from air being aspirated. It's like a perfect seal.
Barrier, okay.
Then you have fair VC. Now here, that top point of the vulva is a bit higher, above the pelvic floor, or maybe the vulvar lips slope forward a little. And this slight change can allow air to enter, that's pneumovagina, or even some manure contamination. It's not ideal.
Right, the seal isn't quite tight enough.
Exactly. And then there's poor VC. In this case, the top of the vulva is significantly higher than the pelvic floor, usually with a really obvious forward slant. Here, manure contamination isn't just occasional, it can happen frequently, even pretty much constantly. So understanding these grades, good, fair, poor, it immediately helps you grasp the functional consequences, the problems that can arise.
Okay, so thinking about those consequences,
Yeah.
what does this mean for the mare's own natural defenses? I read somewhere it's like a fortress with multiple gates.
That's a great analogy. Yeah, her reproductive system is designed with this multi-layered defense. There are essentially three functional seals protecting it. You have the vulva itself, that's the outer gate, then the vulvovaginal constriction, or the vestibular seal, which is a bit further in, and finally the cervix, the gateway to the uterus.
And the vulva, being the outermost one, it's the primary anatomical barrier, isn't it? The first line of defense.
Precisely. It provides the first effective protection against external contaminants like bacteria and debris.
So if that first gate, the vulva, is compromised, well, it puts a huge strain on the other seals further inside.
It does. It burdens those internal barriers, the vestibular seal and the cervix, and significantly increases the chance of infection making its way up into the reproductive tract.
Which is why the ideal vulvar anatomy is so important. It's not just about aesthetics, it's about function.
It's entirely about function. To provide that optimal protection, the vulvar lips need to meet nice and evenly, forming a tight seal along their entire length. And anatomically, ideally, most of the vulva, like 2/3 or even 80% or more, should sit below the bony points of the pelvis, the ischial tuberosities.
Below the pelvic floor, essentially.
Exactly. And the vulvar lips themselves should be pretty much vertical, maybe a slight tilt, but ideally no more than 10 degrees forward or backward from vertical.
Okay, that makes sense structurally.
Yeah.
But you mentioned something earlier about changes.
Ah, yes. And this is really key and sometimes overlooked. The vulva's tone, how tight that seal is, isn't static. It changes based on the mare's hormones. During estrus, when she's in heat, rising estrogen levels cause the vulvar tissues to relax and swell slightly. This means the vulva has less tone, which is actually necessary for mating.
Right, for breeding.
But during diestrus, the period between heats, or during pregnancy, progesterone is dominant. Progesterone increases the tone, making the vulva firmer and the seal tighter.
Ah, okay, so it tightens up when she's not receptive or pregnant.
Precisely. And here's the kind of aha moment. That necessary relaxation during estrus, it actually creates temporary periods of vulnerability. A mare might have, say, borderline conformation. She looks fine, no issues during diestrus when progesterone is high. But then she comes into heat, estrogen rises, the vulva relaxes, and suddenly she's susceptible. She might start aspirating air, wind sucking, only when she's in heat or maybe during strenuous exercise.
Wow, okay. So a problem might only show up at certain times. That's a really important distinction for owners and vets to make.
It really is. It highlights why careful evaluation at different stages of the cycle can be important.
So if that ideal conformation isn't there, either all the time or just sometimes, what are the common ways this structure actually goes wrong? What causes these abnormalities?
That's a really good question because while some mares might be genetically predisposed, the interesting thing is that most of these vulvar conformation issues are actually acquired. They develop over the mare's lifetime.
Acquired. So not necessarily born with it.
Often not. Think about things like just getting older and especially having multiple foals. Advancing age and what we call parity, the number of foals she's had, are really common factors. Over time, the ligaments and tissues that support the perineum can stretch and lose elasticity. This can cause the vulva to elongate and tilt forward more.
So older mares, especially those who've had quite a few foals, are more likely to develop these issues.
Very frequently affected, yes. These older pluriparous mares, as we call them.
And what do these abnormalities actually look like? What are vets seeing?
Well, there's a spectrum. A common one is what we call a high vulval seal, or dorsal displacement. That's where too much of the vulva, maybe more than a third or over 4 centimeters, sits above the brim of the pelvis. Then there's increased angulation, or that cranial tilt we mentioned. The vulva slants forward, sometimes just over 10 degrees, but it can be quite severe, even up to 25 or 50 degrees. This often goes hand in hand with a sunken appearance of the rectum.
Okay, so tilted forward, sometimes quite dramatically.
Yes. You can also see issues with the whole perineal area, a sunken anus, where the anus and rectum seem to have dropped forward, often seen with a flat croup. This indicates a defect in the perineal body itself, that muscular structure between the rectum and vagina. And sometimes the issue is simply that the vulvar lips themselves are underdeveloped or flaccid. They just don't have enough fullness or tone to form that crucial tight seal.
Right. So it's not just the position, but the quality of the tissue itself.
Exactly.
And beyond just age and having foals, you mentioned genetics might play a small role. But what other acquired factors contribute?
Well, genetics and breed predisposition are there. We see abnormal VC in all breeds, but it does seem particularly common in racing breeds, like thoroughbreds and standardbreds. Interestingly, thoroughbreds and maybe American saddlebreds seem more prone to that increased angulation, that forward tilt, whereas breeds like quarter horses and standardbreds often tend to maintain a more vertical orientation, even if other issues arise.
Interesting breed tendencies.
Another really important factor is poor body condition. Significant weight loss is critical. Mares lose fat deposits within the pelvis, the intrapelvic fat, and this fat actually helps support the reproductive tract in its correct position.
Oh, so losing weight can literally cause things to shift.
It can cause the perineum to tilt, yes. Then there's trauma, particularly foaling trauma. Difficult births, oversized foals, or even improper assistance during foaling can cause tears and lacerations in the perineal area, leading to permanent damage and altered conformation.
That makes sense. Difficult foaling can have lasting effects.
Absolutely, and sometimes, ironically, interventions themselves can contribute over time. Repeated Caslix operations, which we'll talk about, can lead to gradual tissue loss along the vulvar lips, potentially making it harder to maintain a good seal long term.
Oh, interesting. So the treatment itself can sometimes lead to issues down the road.
In some cases, yes, if done repeatedly over many years. And then, much less commonly, you might have things like neoplasia tumors in the area that physically push things out of alignment or prevent the lips from closing properly.
Okay, so quite a few potential causes, mostly developing over time, which brings us to the really crucial question. Why should you, the listener, care about these conformational defects? Because, as you hinted, they kick off this whole cascade of problems that can severely impact a mare's ability to get pregnant and stay pregnant. The first domino to fall is that compromised barrier, right? Allowing things in that shouldn't be there.
Exactly. The most immediate and common consequence is pneumovagina, which literally means air in the vagina. It's often called wind sucking. You might even hear an audible sucking sound when the mare moves or exercises. This is probably the single most common condition that predisposes mares to genital infections and infertility.
Air getting in where it shouldn't. Then there's urine.
Yes, urovagina, or urine pooling. If the vulva is tilted or doesn't seal properly, urine can flow back into the vagina during urination and pool there. This is obviously very irritating and creates a bad environment.
Irritating and probably prone to infection too.
Highly prone. And then perhaps the most obvious contamination risk is fecal contamination. If the vulva is tilted forward significantly, especially with that sunken anus, the dorsal part of the vulva can basically form a shelf.
It's a shelf. Oh dear.
Yeah.
A shelf that just collects feces falling from the anus. This introduces a massive load of bacteria directly at the entrance to the reproductive tract.
Okay, so air, urine, feces. None of that belongs in the vagina, and this leads directly to infections moving upwards. Precisely. It leads to ascending reproductive tract infections. These silently climb higher, damaging the mare's reproductive future. Initially, you might see vaginitis, inflammation of the vagina, and cervicitis, inflammation of the cervix, often just from the irritation or trauma of the contamination itself.
Okay, inflammation of the lower parts.
But the bigger concern is when the infection reaches the uterus. This is endometritis, inflammation of the endometrium, the uterine lining. It's a very common and severe consequence of that chronic contamination from the air, the urine, the feces. We often find specific bacteria, like Streptococcus zooepidemicus is a frequent culprit, thriving in that contaminated environment. A common sign a vet might see on ultrasound is persistent fluid inside the uterus, which shouldn't be there.
Right, the uterus should normally clear fluid quickly. Persistent fluid means inflammation.
Usually, yes. And if the inflammation becomes chronic and severe enough, it can even affect the pregnancy itself, leading to placentitis.
Inflammation of the placenta.
Yes, inflammation of the placenta. This is a major cause of late-term pregnancy loss in mares, often around the 6 or 7 month mark.
Wow, so these external conformation issues can ultimately lead to losing the foal late in gestation.
They absolutely can. The overall impact on fertility and pregnancy outcomes is significant. We see everything from general subfertility difficulty, conceiving, right through to outright infertility. We see higher rates of early embryonic death, or ED, which is loss of the pregnancy, usually within the first 90 days. And as we just mentioned, in severe chronic cases, it can lead to abortion later on.
And it's that persistent nature of the contamination that's key, isn't it? It's not just one bad event.
That's such an important point. It's usually not a single acute infection that causes the major fertility problems. It's the ongoing cumulative insult. Low-grade chronic inflammation slowly damages the uterine environment over time. This is why routine breeding soundness exams, or BSEs, are so crucial, even if the mare doesn't seem to have an obvious infection. You need to catch these things early before irreversible damage occurs.
Okay, that makes a lot of sense. Catching it early is key. So if a problem is suspected, how do veterinarians actually diagnose it? What's in their toolkit?
Well, it really starts with a thorough clinical examination. It's a combination of sharp eyes, experienced hands, and then some specific tests. The vet will start by just looking at the mare overall. Assessing her body condition score is important because, as we discussed, poor condition can affect conformation. They'll look closely at the perineal area for any signs of discharge, staining, or swelling.
Just visual inspection first.
Visual inspection, yes, and palpation, feeling the tissues. They'll carefully assess the vulva's vertical alignment, how well the lips meet the apposition, and the general tone of the tissues. And it's really vital to do this before giving the mare any sedation. Sedatives can relax the muscles and tissues, potentially masking poor tone or a poor seal.
Ah, good point. Got to see it in its natural state.
Exactly. Then they might perform the windsucker test. This involves gently parting the vulvar lips and listening carefully for that characteristic inrush of air. If you hear that whoosh, it's a pretty clear sign the seal is incompetent.
A simple but effective test.
Very. For a more objective measure, there's the Caslix index. The vet measures the angle of the vulvar slope relative to vertical and the length of the vulva above the pelvic floor. They multiply these two numbers together. Generally, an index score over 150 strongly suggests a need for surgical correction, like a Caslix procedure. A score under 100 usually indicates normal anatomy and is associated with better fertility outcomes.
So a quantifiable score to help guide decisions.
Yes, it adds objectivity. And then, a crucial part of the exam is the vaginal speculum examination. Using a speculum allows the vet to directly visualize the inside of the vagina and the external part of the cervix. They're looking for any signs of inflammation, redness, discharge, urine pooling, evidence of trauma like old tears or scars, and assessing the appearance and tone of the cervix.
Okay, so that covers the external and vaginal exam pretty thoroughly. But what about assessing the impact deeper inside, like in the uterus?
Right, because the external conformation is only part of the picture. We need to know what's happening internally. That's where ancillary diagnostics come in. A uterine culture in cytology is very common. A sterile swab is used to collect a sample from the uterine lining. The culture attempts to grow any bacteria present, and the cytology involves looking at the cells under a microscope for inflammatory cells, like neutrophils.
So you're looking for bugs and signs of inflammation fighting them.
Exactly. Finding significant bacterial growth plus evidence of inflammation usually confirms an active uterine infection, endometritis. Perhaps one of the most valuable tools, especially for prognosis, is the endometrial biopsy. A tiny piece of the uterine lining is collected. This tissue sample is examined microscopically by a pathologist. They look not just for active inflammation, but also for chronic changes, like scarring or fibrosis and glandular changes. This gives vital information about the health of the uterine lining and the mare's actual ability to carry a pregnancy to term.
So the biopsy tells you not just if there's a problem now, but how much long-term damage might have occurred.
Precisely. It's critical for prognosis. And finally, transrectal ultrasonography is indispensable. The ultrasound probe is placed in the rectum, allowing detailed visualization of the ovaries, the entire uterus, its size, thickness, looking for any fluid accumulation, and the cervix. It provides objective measurements and helps track changes over time or in response to treatment.
It sounds like piecing together a complex puzzle.
It really is. As one source put it, the diagnostic process is a sophisticated interpretive art. You have quantitative data like the Caslix index, culture results, but you have to integrate that with the qualitative observations from the physical exam, the speculum exam, the ultrasound findings, and the biopsy report. Clinical judgment is key.
And you mentioned a trend towards doing this earlier.
Yes, absolutely. The trend is definitely towards preventative diagnostics. Doing a thorough breeding soundness exam, or BSE, before you even plan to breed the mare. Identify and address any conformational issues or subclinical infections beforehand. It optimizes the chances of conception, saves time and money, and avoids a lot of potential heartache down the road.
That makes a huge amount of sense. Be proactive. So the good news is, if problems are found, there are effective ways to manage and treat them, right? Often involving a combination of approaches.
Yes, definitely. There are effective strategies aimed at restoring that anatomical integrity and functional competence. Sometimes non-surgical approaches are enough, or at least part of the plan.
What would those involve?
Well, foundational things first. Addressing any underlying poor body condition through nutritional management is crucial. As we said, getting that intrapelvic fat back can sometimes improve the anatomical relationship and vulvar position. And then meticulous hygiene and environmental control, especially around the time of foaling and breeding, to minimize introducing bacteria into the reproductive tract in the first place.
Basic but important supportive measures. But often it sounds like surgery is needed to physically correct the defects.
Yes, very often surgical correction is necessary, particularly for moderate to severe conformational defects. And the good news is many of these procedures can be done safely on the standing mare, just using local or epidural anesthesia.
Okay, so what are the main surgical options? You mentioned Caslix before.
The Caslix procedure, or vulvoplasty, is definitely the most common surgery performed for poor vulvar conformation, specifically to treat pneumovagina. It involves removing a thin strip of tissue from the edges of the upper part of the vulvar lips and then suturing those edges together. This effectively seals the dorsal portion of the vulva, preventing air and contaminants from entering. The sutures are typically removed after 10 to 14 days.
So it creates a partial seal at the top.
Exactly. But a critical management point here. The surgically sealed portion must be manually opened, usually with sterile scissors before the mare foals. If not, she can suffer severe tearing during delivery.
Oh, wow. That's absolutely crucial to remember.
Absolutely essential. And because tissues can stretch again, a Caslix often needs to be repeated annually throughout a mare's breeding career. Sometimes a temporary breeding stitch is placed, which can be easily removed for natural cover breeding and then replaced.
Okay, so Caslix is common, but maybe not always enough for severe cases.
Correct. For more significant perineal body defects, or if a standard Caslix isn't sufficient, there's the deep Caslix, also called an episioplasty or the GAD technique. It's a more involved two-layer closure that provides more substantial support. For mares with severely altered conformation, especially that dramatic forward tilt and associated urine pooling, there's the perineal body transection, or Pouré operation. This procedure involves carefully cutting specific muscles and tissues to allow the vulva and anus to retract back towards a more normal vertical position.
So that one actually aims to reposition things.
Yes, it addresses the underlying positional problem more directly in those severe cases. Another approach is perineal body reconstruction, which aims to rebuild and reinforce the structural support for the vestibule and the vestibular seal, that second barrier.
Trying to strengthen the tissues there.
Exactly. And for mares with persistent urovagina, the urine pooling, that isn't resolved by correcting the vulvar angle alone, there's a procedure called urethral extension. This involves constructing a tube-like extension of the urethra using the mare's own vaginal lining, directing the urine further back, away from the cervix and uterus.
Wow. Quite an intricate procedure.
It is, and can be effective, but does carry some risks. And finally, of course, if the conformation issue is due to foaling lacerations, surgical repair of those tears is necessary. The timing of repair is important. Sometimes vets wait a bit for initial swelling and bruising to subside before reconstruction.
So it really sounds like the choice of surgery is very specific to the actual anatomical problem.
Absolutely. It's definitely not a one-size-fits-all approach. The surgical method chosen must directly address the specific anatomical defect and its severity. And success isn't just about the surgery itself. Thorough preoperative assessment and diligent postoperative care are just as critical.
Right. So after potentially going through all this, maybe even repeated surgeries like the Caslix, what's the bottom line? What's the long-term prognosis for a mare's fertility?
Well, the expected success rates vary a bit depending on the procedure and the mare's individual situation, of course. For the Caslix procedure, the prognosis for resolving pneumovagina and subsequently improving fertility is generally considered good. But again, there's that caveat that it often needs repeating.
Okay, good, but potentially requires ongoing management.
Yes. For perineal body reconstruction, studies have shown it can significantly increase fertility rates. One study reported something like 14 out of 18 treated mares becoming pregnant, which is quite promising. Urethral extension for urine pooling, the outcomes can be a bit more variable and sometimes difficult to predict. There are potential complications like fistula formation.
So maybe a bit less certain for that one.
Potentially. But for the straightforward repair of perineal lacerations from foaling, the prognosis for restoring normal function and fertility is generally very good to excellent, assuming the repair is done well. Overall, the sources strongly suggest that surgical correction of these caudal reproductive tract issues, these problems at the back end, can really dramatically enhance a mare's chances of conceiving and carrying a foal.
That's encouraging. A dramatic enhancement.
It is. However, and this is a really crucial however, the ultimate success, her actual ability to get pregnant and stay pregnant, is not solely dependent on the success of the vulvar surgery itself. It is critically linked, perhaps even more so, to the pre-existing health of the internal reproductive tract, especially the uterus.
Back to the uterus.
Back to the uterus. If that chronic contamination and inflammation we talked about has already caused irreversible degenerative changes to the endometrium, things like significant scarring, what we call paraglandular fibrosis, where scar tissue forms around the uterine glands.
Choking them off, basically.
Essentially, yes, preventing them from properly nourishing an embryo. If those changes are severe and widespread, the prognosis for that mare successfully carrying a foal to term remains poor, even if you perform a perfect Caslix or other corrective surgery.
So the external fix doesn't magically heal internal damage that's already done.
Exactly. The surgery stops further contamination and damage, but it can't undo significant chronic pathology inside the uterus. This just hammers home the absolute necessity of that comprehensive pre-surgical evaluation, especially the endometrial biopsy, to get a realistic picture of the mare's true fertility potential before undertaking surgery.
That makes perfect sense. You need to know the whole story.
You do. And it also underlines that successful management is often an ongoing commitment. Procedures like Caslix need regular checks and often repetition. And as we touched on, even repeated Caslix can eventually lead to tissue loss, potentially compromising the seal again over the very long term. So it really becomes a sustained, collaborative partnership between the owner, the vet, and the mare, involving ongoing monitoring and reevaluation throughout her breeding career. It's not usually a one-and-done fix.
Wow. We have certainly taken a deep dive today into equine vulvar conformation. It's really quite something to understand how this seemingly external anatomical detail can have such profound ripple effects through a mare's entire reproductive journey. It's a powerful reminder, isn't it, of the intricate balance required for life, for reproduction.
It absolutely is. And I think this discussion really reinforces that you need a truly holistic approach to managing mare reproductive health. It emphasizes prioritizing those preventative measures, being thorough with diagnostics, and then tailoring the management, which is often long term. Ultimately, it's about optimizing the success of breeding programs, preserving valuable genetics, and ensuring the well being of these mares.
And maybe that leaves us all with a slightly provocative thought to mull over. If such specific, seemingly small anatomical details can have such far-reaching consequences in the animal kingdom, what subtle foundational elements in our own lives, maybe our health, our habits, our environments, might be quietly creating unseen challenges or perhaps hidden opportunities for our own long-term success and well-being? Something for you to think about.